Correct answer A. Educational objective. Diagnose hypertension related to bevacizumab therapy. The monoclonal antibody to bevacizumab is associated with the development of significant but reversible hypertension. Bevacizumab is the most likely cause of this patient's hypertension. Bevacizumab is a monoclonal antibody that blocks angiogenesis by inhibiting vascular endothelial growth factor A. It is effective in combination with the standard chemotherapy for the treatment of metastatic colon and gynecologic cancers. Inhibition of vascular endothelial growth factor appears to cause hypertension through several mechanisms, include altered nitric oxide production, increased endothelin-1 production, and alterations in pressure natriuresis relationship. Bevacizumab-related hypertension affects a high proportion of treated patients, and incidence is dose-dependent. Hypertension is most commonly detected at approximately 60 days after therapy initiation and is reversible upon discontinuation of the medication. Because large increases in both diastolic and systolic blood pressure can occur as early as the first week of therapy, all patients taking angiogenesis inhibitor such as bevacizumab should have their blood pressure carefully monitored during therapy, particularly early on. There is no preferred antihypertensive agent for treatment. Interestingly, the development of hypertension may be a marker of a therapeutic response or improved cancer outcome for patients treated with this class of drugs. Cisplatin has been associated with increased risk for venous thromboembolism, supraventricular tachycardia, myocardial ischemia, and cardiomyopathy. May be associated with increased risk for late development of hypertension in long-term cancer survivors. Glucocorticoids such as dexamethasone may contribute to hypertension through an unclear mechanism. However, the timing and the degree of hypertension observed in this patient are typical for a bevacizumab-induced reaction. Common cardiotoxicities associated with Paclitaxel are bradycardia and heart block. Most of these events are asymptomatic and a routine cardiac monitoring is not advocated. Paclitaxel can uncommonly cause hypertension 1% incidence, but more likely to cause hypotension up to 12% incidence. When used in combination with doxorubicin, Paclitaxel is associated with cardiomyopathy, which occurs at a higher incidence than with doxorubicin alone.